This is Tom Salemi. We're here at the very first Aesthetics Innovation Summit. I'm very happy to be joined by Dominic Serafino, the Chairman and CEO of Venus Concept. Tom, thanks for joining us.
Tom, thanks very much for having me.
Our pleasure. Tell us a bit about Venus.
Well, Venus started in 2011. We had our first FDA and started to commercialize. But we did commercialize in a very different way. We felt that in order for the industry to differentiate ourselves from all of our competitors, we had to come at the market with a new approach. And our new approach was really founded in a subscription-based program that in the 7 years that we've been doing has been extremely successful for us and has really created a different momentum to our peers.
Tell us how that program works, because that's come up a few times today. Others seem to be using a subscription model, and it's something I hadn't heard really much about before.
Yeah, I think that in order to be able to understand the value of what a subscription model can do for our space, you have to really understand that the evolution of the industry itself. I've been in it for 25 years, and I used to own a clinic and was a distributor, and so we sort of watched the industry evolve and grow. And what we found is that while in the early 2000s to the mid-2000s, capital equipment costs of $100,000, $150,000 were routine, in 2008 when the economic downturn happened, physicians found it extremely difficult to continue to keep pace with technology and afford it as well. And so what we thought about in 2010 is we kind of looked at the industry and said, what other industries have gone through similar sort of transitions? And we came up, quite frankly, with the cell phone industry, where we said, in the mid-90s, people would buy $3,000 phones, they'd pay $3 a minute for roaming, and so it was somewhat of a carriage trade tool, right, that people use. But the industry realized that in order for that market to survive and continue to prosper and grow, they needed to find a way to get cell phones in the hands of every 10-year-old if they could. So I kind of equate the early stage cell phone model to dermatology and plastic surgery. They were the primary targets for devices in the mid-90s and into the 2000s because they could afford to do it, they could get credit and so on. But beyond 2008, all of that changed. And so now it became very difficult to get credit, bring in new technologies every 2 years as technology continued to change. And so we felt that the way we should go to market to not only offer a good alternative to traditional capital business was to provide all doctors an opportunity to participate in what we call our subscription program. The way it works is that a customer will pay typically between $5,000 and $15,000 down as a licensing fee, and then they go on a 36-month payment program with us, so that typically in the first year we collect about 40% of the total value of the contract, but during the life of that contract, similar to a cell phone, if there's an upgrade, if there's a new technology that comes along, we forgive the debt that's owed on the first platform, replace it with debt on the new platform, so the doctor's always current and always able to talk about the latest technology in his practice. We feel that this has resonated extremely well because doctors now feel that they can actually offer the latest, greatest without fear of bankruptcy or having this financial burden that they carry from products that are no longer relevant in the marketplace.
Well, that's a fascinating approach. So I'm thinking from the doctor perspective, is it almost like leasing a car as well? I mean, the fact that
in many ways, it is. I mean, how we look at it is that, you have to understand that doctors are not business people per se, they're science-based people. So you have to make the model very predictable and very easy to understand financially. And so what we felt that was most important for a doctor is cost certainty. So when a doctor enters into an agreement with us, if he's paying us, for example, $1,500 a month, we know that whether he treats one patient or 100 patients, that's his fixed cost. That makes it very easy for him to understand the economics in his practice. And when you layer in the ability to always stay current through a seamless upgrade program, the doctors have sort of a comfort and a peace of mind, understanding that essentially it's almost impossible not to make money with our model. Whereas where you're looking at other technologies, other competitors, where they download the financial responsibility to financial institutions, et cetera, they don't have a vested interest in ensuring the success of the clinic. In our model, where we've installed over about 10,000 systems globally, we have less than a 2.5% default rate on our contracts.
Wow.
And the reason we have less than a 2.5% default rate in our contracts is because we invest heavily in the post-sale support. We recognize that because we're shoulder to shoulder with our customer, the doctor, we didn't download that financial responsibility to a lending institution. We have an obligation to ensure that they're successful if we're going to be successful, because if we're not supporting them post-sale in a way that they understand and recognize as beneficial to them, we put ourselves in harm's way as well. But the fact that we've been able to maintain a less than a 3% default rate over the last 7 years globally has been somewhat of a testament to not only the quality of the technology, but the execution of our post-sale support.
And I'm guessing that regular access to new technology helps the doctor overall because it brings in new patients who are excited about new technology.
Well, it's even beyond that, and it's absolutely right, because that puts somewhat of a pressure on our R&D team to ensure that they're constantly, creating new technologies that are viable and acceptable to the marketplace. But what's more important is that, let's just say a doctor enters into the category of hair removal. And he goes in and he's 2 years into it, and now there are 15 hair removal centers around him, and he's feeling the pressure of competition. He doesn't want to be a price leader or whatever the case may be. In our model, it's very easy for him to move away from hair removal and go into fat reduction, or to go into cellulite, or into vaginal health. So there are a lot of different options within our portfolio of products that the doctor can sort of weave in and out of depending on the conditions, the competitive landscape in his particular jurisdiction.
That's a great point. Does this subscription model give you sort of an early view on changing trends if you start to see people shifting one way or the other?
One thing that's really important when you have a subscription model like this, the onus is on the company to ensure the success of the doctor. Otherwise, we fail. And because of that, we have a very high-touch philosophy. We've basically implemented a program where we have an army of individuals that go out on a monthly basis, which we affectionately call our practice enhancement managers, and their only job in life is to ensure the success of that clinic. So in other words, they'll teach the clinic how to answer the phone, how to do a patient consultation, how to select a patient, how to charge and deal with competitive pressures, create marketing campaigns, et cetera, et cetera. That's all included in our monthly fees under our subscription, so that resonates in the cost certainty realm as well. But because we have such a high level of touch with each of the clinics, we learn very early, where the trends are. In other words, we can be proactive if a doctor is failing for whatever reason. So if we're being able to be proactive as opposed to reactive, we're able to mitigate risk for us and the doctor as well. If we see that there's a trend in the area of a differentiation in technology platforms, we can be ahead of that for the doctor by at least giving him the heads up, because we do the market research for him to help him understand what's going on in his particular areas. Which, when you think about these procedures, they're all delegatable acts anyway. Most times doctors aren't even involved in the actual hands-on completion of these treatments, because they are giving them to nurses or estheticians depending on the jurisdiction that they live in. So they're somewhat void of direct knowledge of what's actually happening day to day, and our team allows us to feed him very good intelligence as to what's going on, not only in his own practice, but in the area around him.
Great. And just final question, do you feel, given you experienced the recession of 10 years ago, that certainly put a crimp into the growth of aesthetics, didn't necessarily stifle it, but it certainly slowed things down. How are we positioned today to weather another downturn?
Yeah, and that's a great question, because the reality of it is it's cyclical, right? And I think that as we look at our business, companies, and I totally understand the whole razor blade approach to a business, because when times are good, companies prosper, they're able to take advantage and leverage the patient flow and so on because of the revenues that are typically at higher margin than the actual technology itself that come through the per patient charge, right? However, when markets turn, that argument becomes less compelling for the company's profitability and continued growth. We believe that our model that creates a cost certainty for the physician, and in some categories we also have a disposable, but a very reasonably priced disposable that isn't a lifeline to our revenue growth. We feel that if there is any kind of a downturn economically, the customers who have our technology with a cost certainty combined with our post-sale support has a greater likelihood of continuing to experience success with their practice. On top of that, what it really does allows the doctor to do is to change his pricing models to support any kind of a downturn, because he doesn't have a hard cost of $200 every time he turns on the machine, for example. He doesn't have to deal with that. So he's able to have complete flexibility based on what's going on in the economic realities of his country or whatever may be happening.
Absolutely. Well, interesting times, and I certainly hope we don't have to test that recession idea anytime soon.
Yeah, none of us want to test that recession thing ever again after 2008, but I appreciate you taking the time to learn about Venus Concept, and we're very excited about our journey, and 450 employees globally out of 27 direct offices, really does resonate with our customers, and we're on a special journey, we believe, because we are doing something that's never been done in our industry before, and we kind of like to cut the path.
Excellent. Well, we're happy to have you here cutting that path at the Aesthetics Innovation Summit.
Appreciate it very much. Thank you.